If you have diabetes, there are a number of doctors you're going to need to see regularly, and this is a good thing. I'm saying this because I often have patients with diabetes that don't come to their doctor's appointments regularly, and they don't understand necessarily why this is important. When it comes to diabetes, remember, diabetes is a condition that literally affects your whole body. Yes, the sugars are important, very, very, very important, but it's not the only thing that's important. You know why? It's because sugars in your body that are elevated, yes, it's a problem, but it's also a problem because those sugars can affect other parts of your body. They can cause kidney damage. They can cause problems with your eyes and your vision. They can cause problems with your nerves, problems with your heart, and so many other things, which is why if you have diabetes, you've got to be seeing your doctor regularly. Today, I'm talking about specifically kidney checks, eye checks, and foot checks. These are 3 checks, and there's others that you need as well, but these are 3 specific checks that you need to be getting on a regular basis if you are diabetic, even if your sugar is controlled. Regardless of whether your sugar is controlled or not, we hope it's controlled, you need to get these 3 checks. There are others as well, but we'll start with this. So let's start with the eyes. First of all, you're probably saying, well, I don't understand why the eyes matter. I have diabetes, it's a sugar thing. Actually, what happens is the sugar, the elevated sugars actually affects your eyes, affects the blood vessels in your eyes, and so many other aspects of eye care. Diabetes can predispose you to a number of eye conditions, one of them being diabetic retinopathy. By the way, this is the most frequent cause of new cases of blindness among people aged 20 to 74 years old in developed countries. And guys, things like glaucoma, cataracts, and other eye conditions actually occur earlier and more frequently in people with diabetes. Guys, you gotta get your eyes checked. So what do you need to do? Well, this is according to the American Diabetes Association. They say that adults with type 1 diabetes should have an initial comprehensive eye exam by an ophthalmologist or optometrist within 5 years after the onset of their diabetes. People with type 2 diabetes, which is most of the patients I see, should have an initial comprehensive eye examination at the time of their diabetes diagnosis. So the minute you've gotten diagnosed with diabetes, you need to have an eye exam. And then from then on, your doctor will tell you how often you need to be seen. This will be determined by what eye conditions they find or don't find, etc., how healthy your eyes are, okay? Now let's move on to the feet, because feet are very important. What can you get from having diabetes with your feet? You can get something called diabetic neuropathy. That means the nerves in your feet and extremities may not work as well. You may not feel things as well. Also, in conjunction with this and separate, related to other vascular issues that can come with diabetes, people with diabetes may also be more prone to getting ulcers and things like this. So what do you need? You need to make sure that you're getting your feet checked. Not only your feet looked at to make sure there are no ulcers or wounds or things like that, because remember, in diabetes, wounds sometimes do not heal as well, and sometimes blood flow is not as good, depending on the patient. But according to the American Diabetes Association, all people with diabetes should be assessed for what we call diabetic peripheral neuropathy. That is, nerve changes due to diabetes starting at the diagnosis of type 2 diabetes and 5 years after the diagnosis of type 1 diabetes. And then usually it's about yearly that you see the foot doctor or have your doctor check your feet after that. Really important to get your feet checked, and also making sure that you're wearing shoes, you're not going barefoot, to protect your feet and things like that. And finally, the kidney. This is so important because diabetic nephropathy, that's diabetic kidney disease, is something that is so common. I have videos specifically on chronic kidney disease and diabetic kidney disease. DM me if you want those videos. But this is really important. When we generally assess and screen people for diabetic kidney disease, it's usually a lab test. And in my office, I'm usually doing this lab test along with the tests for my the A1C, which is to check the sugars, the cholesterol, and things like that. So chances are your doctor is already doing this, whether you know about it or not. But it's something to have a conversation with your doctor about, just to see where your numbers are and how things are going. But the frequency at which you should get your kidney checked, and by the way, it's important to get your kidney checked, as I mentioned in the beginning, because diabetes can affect the kidneys. It can cause kidney damage, kidney disease, even if it's not controlled, lead to kidney failure. How often you should get your kidneys checked is, according to the American Diabetes Association, you should get your kidneys checked at least yearly. But I actually argue for probably more than this. And if you're seeing your doctor on a regular interval, you're probably getting it done more than this. I ask my patients to come back who are being titrated with their meds. Maybe their A1C is not controlled, every 3 to 4 months. People who are controlled may go up to 6 months, but I'm checking labs before then. Your doctor may be too. American Diabetes Association says at least yearly, checking for protein in your urine, checking for the estimated glomerular filtration rate. It's hard to say, EGFR. But certainly if you have chronic kidney disease or kidney problems that have been identified, that checking should be done more frequently. But like I said, you might even be getting it done more frequently anyway. It's just another reason, guys, why you need to make sure you're seeing your doctor regularly. It's not just about the sugar. It's about your eyes, your kidney, your heart, your feet, your nerves, so many other things. These are just 3 checks to make sure that you are doing and talking to your doctor about. Guys, I'm Dr. Jen Caudle. Let me know if this video was helpful. Please write in the comments how often your doctors screen you or what you do. Again, this is these are based on guidelines from the American Diabetes Association with some of my personal experience peppered in. Your doctor may choose to do something different based on your situation. Always defer and check with your doctor. The point of this video is to let you know that you must be getting these things checked regularly, and they need to be checked continually, meaning it's not just a one and done thing. It's something that you need to keep up, okay? Again, let me know what you do in the comments. I'm Dr. Jen on Facebook. Please like and follow my page. For those of you who send stars, I respond personally. Thank you so much. Also, consider joining my subscription groups for exclusive content on YouTube. It's good to see you. Please subscribe to my channel. Click the little bell for updates. Guys, go to drjencaudle.com for my free health newsletter, my daily health tips, and so much more. I'll see you soon.